17 zeros, and 2 zeros off, you are in a morphologic remission, and 2 log reductions is maybe a CCYR, and then anything lower than that is a molecular remission. So there's another way of looking at it, just to give you a picturesque view. So CCYR, so just 2 logs, 10 to the power 12, 10 to the power 10. And residual disease is assessed at the molecular level beyond the cytogenetics. And all of you know that for cytogenetics, you need cells in metaphase. You look at 20 to 23 cells. And the molecular remission is somewhat variable. One of the reasons is the technicality of doing the test itself, reductions below the standardized baseline. So that is the definition for achieving a complete molecular remission. 4.5 log reductions. And of course, it's an arbitrary line after all. At the end of the day, you draw a line somewhere and say, it's 3 log reductions or 4.5 log reductions.
A German component and a Dutch component. In Germany, they do double transplant. In Holland, they do a single transplant. And you can see here that for the 414, the group that do the double transplant, the survival in the PAD patients are similar whether they have 414 or not, whereas it is still significantly different for those that have a single transplant. So in terms of the 414, this 2 trial may suggest, rather counterintuitively to what we have heard earlier today, that there may be a subgroup of patients with double transplant will benefit patients with 414 translocation. What about 17p then? Mayo classification, we can further refine, I feel, the prognosis or risk stratification in these categories. There are now very good risk patients that can be identified, as in the French study, where they may have very long survival, and this constitutes probably on average about 20% of the patient. The previous high-risk patient, the 17p and the 414, can now be further refined because with Velcade induction as well as potentially double transplant, these patients can now easily be separated out from the 17p patients. Average survival is about 5 years and it's about 15 to 20% of the patients.
It's frequently detected in adult AML with a relatively high incidence in the younger population. In normal karyotype AML, there is an important cooperation between mutations such as NPM1, but also DNMT3A. Both the ratio mutant versus wild type and the insertion site, especially the beta-1 cheat, are important prognostic markers. For the sake of time, I will not allude to this, but I would like to highlight some safety issues because there may be some drug interactions that influence TKA metabolism via the cytochrome P4550 because these agents can block the glucuronidation of drugs. And just a simple example is paracetamol or acetaminophen for our American colleagues, which may lead to severe hepatotoxicity. So one should be aware of these contraindications. And with this, I do thank you for your attention.
Thank you, Dr. Wang. Dr. Combra already talked about the AML MRD. Now I will focus on molecular monitoring of MRD in AML. First, I will talk about the molecular markers for monitoring, and then prognostic implications, a little bit on preemptive therapy on molecular relapse, and finally, suggested samples and timing for monitoring. Some of my talk maybe overlap with Dr. Combra's talk. You can see, you may see that as a refresh of Dr. Combra's talk.
The diagnosis of this type of lymphoma, and the median time is around 9 months. The first impression should be the benign malignant nasopharyngitis in about 60%, or chronic sinusitis or rhinosinusitis is around 1/3. And after the biopsy, with adequate biopsy, it showed that the diagnosis maybe the NKT cell lymphoma is around 40%. Most of them are male. Okay? And the primary site of tumor is mostly the nasal cavity and nasopharyngeal regions. And sometimes the case presented with mass of infiltration. The local invasion is absolutely found, and there is a rare bone marrow involvement. Okay. The LDH, there is mostly the LDH is equally equal, and we have the opportunity to record the EBV and A status just only 8 patients. And the treatment outcome is